Good morning. My name is Latresa Stewart, and I'm here to present to you my case today for my patient John Doe, who is 64 years old, a black male with a history of hypertension. His complaint today presented to the clinic with complaints of headaches and blurred vision for the past 2 days. Mr. Joe reports that he has been, experiencing headaches, episodes of blurred vision over the last 48 hours. He denies any associated symptoms such as weakness, numbness, chest pain, shortness of breath, palpitation, or recent illicit drug use. He confirms compliance with his prescribed medication that he used daily, which he took as usual this morning. His medication was just basically hydrochlorothiazide 12.5, and his metoprolol was 50 milligrams. His medical history is basically diagnosed several years ago and currently managed with hydrochlorothiazide and metoprolol. He was diagnosed with hypertension for that, and then hyperlipidemia. His recently lab results from 3 weeks ago indicated elevated cholesterol levels, but Mr. Doe not yet returned for these results or started on any medication. He has no history of diabetes or any other chronic conditions. Now, his family history, he states that he has no significant family history or cardiovascular disease or other notable illness. But he did state that he believed that his father, because it was unknown and they didn't do an autopsy, could have died from a heart attack. And that was done in 5 years ago. His social history, Mr. Doe does not smoke or occasionally consume alcohol. He denies his diet is relatively balanced, but he admits to occasionally indulging in salty and fatty foods. He remains physically active, though he has not engaged in a regular exercise routine. He states that he feels like his exercise is based off of him working and moving around at work, but he does not go to a gym or walk or do any exercise at home other than working. Apart from the primary complaint, he has an unremarkable review of symptoms. His vital signs was 100. His blood pressure from his vital signs was 195 over 115, which was very concerning to me. We immediately, decided to have him sit and relax. And then we waited 15 minutes to retake his blood pressure, and it continued to read 195 over 115. His pulse was 90, and his temp was 98.9. His respiration rates was in the 20 breaths per minute. His general appearance, he did seem anxious, but in no acute distress. He wasn't like short of breath, but he was just very nervous and very concerned that he didn't understand after taking his medication that his blood pressure still continually runs high. He has no signs of acute papilledema or other ocular abnormalities in his eyes. His eyesight was okay at the time, but his complaint still stated that occasionally when he gets up, he noticed that he cannot, get a good vision, and that he has to stop and just rub his eyes or clear his eyes to state that he's having blurred vision. He did seem a little blurred later during the exam, and so we retook his visual acuity test, and again he was able to read between the 20, right eye 20/20, left eye was 20/30 at the time. His cardiovascular, regular heart rate and rhythm, he had no murmur, gallops heard or noted or rubs. His respiratory clear with auscultation, but bilaterally, no wheezing, no rales, or no rhonchi. His neurological, no focal deficits, cranial nerves was intact. His between 2 through 8, they were all intact. His extremities, no edema, and the pulses rate was 2+ bilateral. So basically, the subject, Mr. Doe, he came here today presented with the blurred vision likely related to severely elevated blood pressure. Significant findings including a blood pressure with the 195/115 being the final result after taking it twice on both arms, right and left, one sitting and one standing, and a recent lipid panel showing the total cholesterol was 263. His LDL was 192. His HDL was 35, and his triglycerides was 180. The different diagnoses that I could come up with was hypertensive urgency. And then that was the first and my foremost. And then his second one, I decided he could fall under hypertensive encephalopathy, less likely given lack of neurological symptoms. And then I also thought of acute glaucoma, but it was unlikely present because his vision was okay and he didn't suffer with eye pain. Intracranial mass lesion was my final differential diagnosis, less likely without neurological deficits. So my final diagnosis would be hypertensive urgency secondary to poorly controlled hypertension and hyperlipidemia. My plan for Mr. Doe is increase his medication, increase his and provide him with medication for his high cholesterol, and then get him into counseling or a referral for diet planning for nutrition to help with his dieting, and to have him consider what's going on, what resources he may have for like exercising, and educating him on how he should exercise, changing his lifestyle modification, advising him to adopt to a healthy diet such as DASH diet, focusing and reducing sodium and increasing potassium intake, encouraging him to do regular physical exercise, even if he's just walking after dinner 30 minutes a day, but to increase his exercise at least 150 minutes if possible, to do walking or a little cardiovascular, a little jogging if he's able. We discussed weight management and talked about how he can strategize his weight, being overweight. He's going to have a follow-up scheduled visit 1 week to reassess his blood pressure and medication effectiveness. If if the medication by increasing doesn't help, we will escort him, redirect him to the emergency room so that he can be more evaluated daily at the hospital. We're going to repeat his lipid panels within 4 to 6 weeks and evaluate his statin therapy. Consider referral cardiologist to evaluate the resistant hypertension, and a dietitian, as I said, for personalized diet advice. This concludes my presentation.